Hi, Dr. Tammy here. Welcome everybody to Fertility Secrets They Don't Want You to Know About. If you all can hear me okay, can someone just raise their hand and let me know you're out there? There's a little button on there that just a little hand raise. Okay, great, thanks. It's wonderful to see everybody on here today. I know that video is compelling. If you're here today, you're probably struggling with fertility, infertility issues. And you're not alone. 1 in 6 couples suffer with fertility issues. So what I want to do with you is share today some natural alternatives and really enlighten you about some of the things that are just not available. And even as a physician, were not really known and available to me. I've helped thousands and thousands of women with hormone issues and fertility issues. I'm very excited to share this information today. So who will benefit from this seminar today? We're going to talk about the root of all hormone issues, fertility issues, MTHFR or methylation, and tie this into the digestive tract or the gut for couples who need to know the impact on their fertility and pregnancy, are wishing to begin preconception care, or you're currently attempting to or unable to get pregnant. So like I said, it's not your fault and you're not alone. 1 out of 6 couples have difficulty getting pregnant. Infertility is devastating. The thing that's most available today is in vitro fertilization and fertility drugs. And what I find is that these are not benign drugs. They can cause so many problems. They can cause uterine cancer later and birth defects. In fact, I'd like to share a little video here with you that was a little news clip done.
A new study is likely to cause concern for women. It suggests that some fertility drugs may increase the risk of uterine cancer. Joining us to sort it out, early show medical contributor Dr. Holly Phillips. Good morning.
Good morning, Maggie.
For women out there listening, which drugs specifically are we talking about?
Well, one of the most important that was addressed in this study is clomiphene. It's also known as Clomid, and it is probably the most common fertility drug used today. The way Clomid works is it makes the body think its estrogen levels are lower than they actually are, and that helps with ovulation to release more eggs. That helps women become pregnant.
And the study found a link between women who took that drug and uterine cancer later in life?
It did. This study was significant in that it followed women for 30 years, and so it looked at their entire lifetime risk of developing cancers, and it did find a 3 to 4 time increase in uterine cancer in women who had taken this drug. Now, this isn't the first time we've seen a link between things that modulate estrogen and uterine cancers, but this is one of the first times we've seen this type of link with the fertility drugs.
And doesn't it make sense biologically, because drugs like tamoxifen, which do, have a similar effect as these drugs, have been known to cause cancer potentially?
Right. Well, what we do know is tamoxifen and other particularly unopposed estrogens have been linked with uterine cancer, and that's why we don't use them, say, after menopause. Now
So that's just a little news clip that was done that really talks about some of the issues later on with these fertility drugs. And I've seen multiple times patients have uterine, ovarian cancer problems down the line, and even further fertility problems later. Fertility processes and procedures, IVF as well, are not benign procedures. I want to share with you this little video of Ashley, who really depicts the pain and the agony of that whole process. The interesting thing is this is a multi-billion-dollar industry, and people think that if they've struggled with fertility for 3, 6, 9 months, or a year, there must be something wrong. And the only way to get pregnant is to do these routes of this IVF or these medications. And who's benefiting from that? Well, the pharmaceutical companies are absolutely benefiting from that. It's a multi-billion-dollar a year industry. And the people are just tied into this situation thinking that that's their only option, and it's incredibly expensive. In fact, some couples spend up to $150,000 trying to have a family, and the average cost in our country is $10,000 to $15,000 per try for in vitro fertilization. This doesn't include testing or medications. There's no guarantee, and that's just per try. So it can add up very, very quickly. Sorry, a little glitch there. That's Ashley again. So anyway, it's a painful process. It's an expensive process. And it can also, those medications can cause birth defects. According to the CDC, 1 in every 33 babies are born with a birth defect. It's a natural process, and we really just want to make things as natural as possible so that you have a healthy baby, because that's really what you want, is to have a healthy baby. I have spoken all over. I have done news interviews. This is me with Suzanne Summers. I've helped thousands and thousands of women get pregnant naturally, and it's just such an amazing process to be able to help people. There is completely a natural alternative. And my why starts pretty much, my story is that I've had hormone issues pretty much my whole life. I had infertility for over 13 years. And I finally was able to get pregnant, and I lost my baby at 3 months. A miscarriage is not a lost pregnancy or a stillborn. It is your baby, a human being, and she still is my baby. I lost her at 3 months. And, people just kind of say, oh, it's God's will, or, they just try to pacify you and make you feel better. But the truth is a pregnancy loss at 3 months is a fully formed baby, and is my little girl, and I really, really wanted her. The good news and the happy ending is that through all my hormone imbalances, my personal tragedy, I wanted to understand what was going on. And when I went to the doctor, and I was a doctor at the time and I didn't know, they were like, well, we don't know why. And we could do some genetic testing, but usually we don't do that after 3 losses. And it was just devastating. I was terrified to try again, but I did. And I was able to finally get pregnant. And this is my son. He's 11 years old now. He's the joy of my life. And being a mom is one of the most important things and most important jobs on the planet. And it just gives me so much satisfaction. This is my little boy now. He's 11. And every day he's just a joy. And I'm so grateful for him. And my personal mission, my why, is to help women all over the world get pregnant and get pregnant naturally, so they don't have to take artificial drugs that might cause uterine or ovarian or breast cancer later. And then, the worst thing would be to have your baby and later get cancer and die and not be around to raise them. So I'm very passionate about that. And through the process, people feel better. I just had a lady the other day that we're coaching her, and I told her that the most exciting thing for me is that we're going to get control of her periods, and she's going to feel better. She's had fibromyalgia, joint pain, and that's just really exciting to help people feel better. You want to feel good. You want to be healthy for your baby so that you can have a great life with them. And if you want to have a complete 100% natural baby, that's the first step, is really understanding the secrets that they don't want you to know about. This is just some of my success stories that I'm really excited to share with you. This is Casey. She's here on the left. She's our nurse practitioner. And sadly, she just resigned because she got pregnant. Casey had been through 3 rounds of in vitro fertilization and had infertility for a couple of years. She was able to finally get pregnant through our system in about 3 months after working for us. And she was traveling from Oklahoma to our office in Rogers. She just decided that now that she was pregnant, that would just be easier for her to work at Oklahoma now. But so exciting, and she's so passionate about what she does. And I think it's funny because she was a little skeptical when she started with us, but she'd kind of given up on having a baby, so it was just very exciting. This is Allison's baby over on the right. Allison had come in with severe PCOS, and she had been told that her eggs were too old and that she couldn't have a baby. So she came to us just for getting her hormones balanced. She was sick and tired of being sick and tired. Her joints hurt. She had a lot of masculinization, like beard and acne, and was severely overweight. And so she just came to us for that. And I told her, do you want to get pregnant? She's like, oh my gosh, I totally given up on that. So I teased her, and the reason I like to talk about her is because I told her that if she had a baby girl, that she had to name her Tammy. Well, she did have a baby girl. This is her ultrasound here, and this is a picture of her baby, but she didn't name her Tammy, but that's okay. So maybe someone out there that will be helping eventually will name their little girl Tammy. But anyway, Allison's baby is doing fabulous now. So the question comes up, why don't they teach you this stuff in medical school? And pretty much I just knew when I was in med school about the process of how you get pregnant. I think everybody pretty much knows that. A little bit of physiology. And then we were pretty much told that if someone struggled with fertility issues, that, that's the specialty of OBGYN, and they go through all those fertility treatments, and there really just wasn't a whole lot of other options out there. And I really think that I've gotten into what I call functional medicine. The drug reps don't come see me anymore. I use bioidentical hormones and supplements to help people get off medications. And that's not really welcomed by the pharmaceutical industry at all, or the insurance industry, because they just want to keep you in the box and farm through. So your doctors aren't bad. They love you. They go into it with the best intentions, but we're really just marketed by all these pharmaceutical companies, and it's absolutely crazy. In fact, when I was in residency, I remember the pharmaceutical companies buying doctors, literally courting them, buying them Armani suits and Rolex watches and golf cruises and trips and just unbelievable excess. And they don't do that anymore. Now they spend their money on advertising. So if you watch the news at night, you'll see it's just ridiculous how many ads. If you read like Women's Day magazine, full of pharmaceutical ads. So you just really have to be aware that the culture is set now, and doctors are just in that box. So if you go out and you try to find someone to work with you naturally, there's just not a lot of options out there. In fact, I've done multiple internet searches, and it's just so sad that there's just not much out there to help people naturally. So are you a candidate for the natural protocol that I've developed? Well, the first question I have to ask is, are you healthy? This is a depiction of a female reproductive tract. Do you have ovaries? Do you have uterus? If you've had a hysterectomy or you've had your ovaries removed, well, there's not much I can do to help you with this process. But if everything's structurally intact, even if you've had infections or fallopian tube blockages or any kind of structural problems, endometriosis, PCOS, as long as you're still menstruating and you have the potential to have ovulation, then this is absolutely for you. The other question is dad healthy? And even if he has low sperm count, or, we have some other kind of issues with physiology, we also can help dad as well. And we support your significant other or the dad through lots of different processes that we do as well through coaching. So as long as he's generally healthy, doesn't have cancer or hasn't had any of his parts removed either, absolutely we can help both of you. This is absolutely for you, and I'm so excited to share this information. So I'm going to go ahead and get started. The first thing you have to know about why you're not getting pregnant and what you have to do about it is you have to understand the root of everything that's going on with you is hormone imbalance. So many women go to the doctor and they say, I think my hormones are imbalanced. Can you check my hormones? And there's so much minimization, patronization, everything that goes on in the traditional model because doctors just don't know how to regulate hormones naturally. And they really don't have the time to spend with you or the experience with natural hormone therapy to be able to really give you all your options with hormone imbalances. So I'm excited that I bring that to the table, 15 years of experience with helping women balance their hormones and get to feeling better as well. So I'm going to share that with you. Methylation issues. Methylation is the process by where your body clears toxins. So I'm going to talk quite a bit about that, about toxins and clearance. One of the things that I tell people with hormone imbalance is when you gain weight, belly fat is actually protective. Belly fat is upregulated by a hormone called cortisol to pull toxins away from your internal organs. Now, we don't like belly fat, but belly fat is actually protective. So if we get rid of the toxins, we get rid of the belly fat. Clearing toxins is absolutely essential for you to be healthy, to get pregnant, and to have a healthy pregnancy so that you don't have a miscarriage or a baby with birth defects. So this is all very important. I'm going to talk about this today. Stress reduction is very important. I think that so many times we get stressed out, and I know as 13 years went on and on and on for myself, thinking every month, when am I going to get pregnant? What's wrong with me? That's all very stressful as well, not to mention the stress of, life and finances and mortgages and, paying the bills and getting along with your spouse. So all that is very, very important, and we have to address that. Nutrition is very important as well. And I think there's quite a few things that are not shared with the general population. For example, you're told to take folic acid, get folic acid in your prenatal vitamins. And for some people, folic acid could actually keep you from getting pregnant. So I'm going to share that information with you as well. I put this together. I like to keep things simple. I'm a simple kind of girl. I like to make sure that information makes sense to me. It's simple, that it resonates with me. So if this information resonates with you, I hope that you'll be compelled to really take action, because knowledge without action is just doesn't do anything for you. So putting this in 7 easy steps is what I want to do for you today. So the first step, and this is going to sound kind of maybe a little hokey or, oh yeah, whatever. But the first step is focus on getting healthy before thinking about getting pregnant. And I tell people that it usually takes about 12 weeks of making these changes for your body to adapt. It takes about 120 days for you to really heal your eggs and your ovaries and the ovulation process. So I want you just to prepare that, even though these changes could happen very quickly and you could even get pregnant after the first month, really I want you to focus on just getting pregnant or just getting healthy for the next 120 days so that we can really prepare the body for what's coming. Optimal health begins in your gut. And I know that sounds maybe cliche, that you are what you eat, but absolutely, and I think the reason that we have most of the infertility issues that we do, I was just talking to my husband this morning, we're kind of just joking around, but we're talking about, is it infertility or fertility? What do you call it? Or what are the secrets about fertility or infertility? So there's no secret about fertility. Everybody knows how to get pregnant. The secrets are around infertility. And I kind of joked about conspiracy theory of all the, food scientists and the way they've changed our food over the last 40 years. But it's really, really true. Our crops are not turned over, so they're minerally depleted. We don't get the vitamins and minerals that we got 40 years ago. And then the food scientists are genetically modifying food so that it doesn't respond to pesticides. And then, we have these issues with gluten and many other issues. So it's a real challenge with all the pesticides, the hormones that are in our food supply, the pasteurization processes. It's like, where do you start? Do you just what can you eat? So anyway, I try to keep things simple, but even if you ate from the Garden of Eden, healthy, 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 one of the biggest struggles that I find that has led to fertility or infertility issues with women, to the point that now we are 1 in 6 couples having fertility issues, is something called leaky gut. Now, some doctors will poo-poo this because they really don't understand it. They don't have time to really educate their patients about it. But there are thousands of peer-reviewed journals in gastroenterology, JAMA, Journal of American Medical Association, about leaky gut and small bowel overgrowth and imbalances in our bacterial flora in the gut. This is a very real problem, and it is at the root of your infertility issues. So you absolutely have to understand this if you want to have a 100% natural baby. So what is leaky gut, why it happens, and what to do about it? Well, I drew this little picture, and I just think it's just really simple, but it really shows what's going on in leaky gut. So when you chew your food, it goes to the stomach, and you have to have adequate stomach acid to break down the food. And then the food goes into the intestines. And if you looked at the intestines under a microscope, you would see that that it is only one cell layer thick. That's a good thing and a bad thing. That's a good thing because if it's disrupted, it heals quickly. It's a bad thing because it can be disrupted very easily. And here in the intestinal wall, what we have is bacteria and yeast that normally break down our food into its nutrients, its vitamins and minerals. And then only the vitamins and minerals get through this purple protective layer, through this cellular layer, these adhesion molecules, and down to the red, which is the bloodstream. So large chunks of food are not supposed to get down here to the bloodstream. Only the nutrients, the minerals, the B12s, your vitamins get down here. And then hopefully you have a gallbladder. The gallbladder makes soap that breaks down fat. If you've ever tried to wash dishes without soap, you can't really break down fatty, dirty substances on your plates. So you need that. And then also the pancreas not only makes insulin, which is your sugar storage hormone, which gets messed up when you have PCOS, but it also makes digestive enzymes. So these enzymes are critical to the breakdown of your food. Well, what happens is in leaky gut, all of these processes are messed up. Maybe the gallbladder is not working functionally because you have too much estrogen in the system, which a lot of women who have hormone imbalances do. They don't have the digestive enzymes being made properly because maybe they have PCOS and the pancreas is not working properly to make digestive enzymes. We have low stomach acid. We have absence of the bacterial flora that break down our nutrients. And then we have maybe medications that you've taken or stress or different things have broken down this protective barrier. Now food literally falls down through these cellular layers and into the bloodstream, and food is triggering an immune response. That's not normal. Well, the cool thing is we have a blood test that can actually identify if food falls down into the bloodstream and triggers an immune response, which foods can trigger that immune response. And what happens is cortisol is made in response to this immune response. 80% of your immune system is found in the intestinal tract. So this is the core of everything: autoimmune disease, fibromyalgia. In fact, I learned this blood test, this food sensitivity blood test, from a chiropractor who did it exclusively for chronic pain, fibromyalgia, joint pain. And the interesting thing is that chiropractors can't write prescriptions like doctors like I can. And so what they have to do is they have to explore other alternatives. What's the root cause of some of these imbalances? And when cortisol has to be balanced out with your estrogen and progesterone, if you're making cortisol all the time, you're going to have pain, you're going to have inflammation, and then you're going to have problems with fertility as well. So this is literally a blood test that can identify the foods that can make you infertile. So I think of this like diesel fuel and unleaded fuel. If you put diesel fuel in an unleaded tank, your car's not going to go very far, right? So in this person, the ones in red are the ones that they're sensitive to. And the very first thing on the list is asparagus. Well, you probably eat asparagus all the time thinking, I'm eating healthy for my fertility. But asparagus could literally be keeping you from getting pregnant. So this is a wonderful blood test. I think every woman who's struggling with fertility should be offered this blood test. And you'll notice on here is gluten down here in the G's. And there's a lot of hype about gluten-free diets. And the problem is that sometimes when people give up gluten, they have other food sensitivities. When you give up gluten, a protein in bread, and you're giving up breads and pastas, maybe you start eating a lot of corn. Well, if you have a corn sensitivity, that's causing inflammation and you just don't feel any better. So a lot of times I think some of the people saying, well, that's just hype because I gave up gluten and it didn't make me feel any better, was because they really weren't considering all the other things that they could be sensitive to as well. So cow's milk is on here. And what we do is we do an elimination diet with this blood test. Elimination diet without this blood test is really hard to do because you have to go for weeks at a time without eating all these different foods and keeping track. I like to keep it simple. So I just love having a blood test that identifies the foods that cause inflammation, increase your cortisol, which increase belly fat, which unbalance your hormones, and can affect your fertility. So this is really exciting to have this blood test, and we do this in all our women that we're starting our pre-pregnancy planning, meal planning, and that sort of thing. So eating healthy is just not enough. You really have to understand these principles. And what we do is a 21-day detox. where we have you avoid all the foods in red that you're sensitive to. And they rate these foods 1 through 3. So 3 is a more severe response than a 1. And then after that 21 days, we start reintroducing these foods back in. And we use very specific supplements that heal up the digestive tract so that reintroducing these foods will not cause sensitivities in the future for you. So it's not like you can't ever have these foods again. But while you're trying to get pregnant, it is essential that you avoid foods that your body just doesn't work well with. So again, like diesel fuel and unleaded fuel, you can't put diesel fuel in an unleaded tank and expect it to go. So this is really exciting. This is really unique. I don't know of anyone in the world who is using this test for fertility, so I'm really excited to have this information. I feel like God has provided so much for me along my path, along these years of understanding my own hormone issues. I've had stomach problems pretty much all my life, hormone imbalance issues. And so my research and understanding this has just been amazing. And I feel like it's just been divinely delivered. They say when the student is ready, the teacher will appear. So I'm very excited to be offering these steps and components that are absolutely essential to getting pregnant, staying pregnant, having a healthy baby, having a healthy life. And we have a whole wellness program that we help people through this process, and it's very exciting. Step 2, you want to start some interval training. And I wish I could tell you that fitness wasn't a component of this, but it absolutely is. I think of it like a 3-legged stool. You can't pull one of the legs off of a stool and expect it to stand up. So fitness is important. It keeps the body healthy. It regulates the hormones. But you don't have to kill yourself. You don't have to have a gym membership. You don't have to, lift heavy weights. I like Tabata or interval training, which is if you just have 11 to 15 minutes a day, just 3 times a week, basically what you do is 20 seconds on, 20 seconds off of interval. And even if you just, in the dead of winter, can run in place, high intensity for 20 seconds, and then you rest 20 seconds, high intensity, air punch up, bag in the air, and then you rest for 20 seconds for 11 minutes. That's all you have to do. And there are many, many research studies supporting that is hormonally fat burning fitness interval training. So that's really exciting, and that's something that you'll want to start as soon as possible. Step 3, progesterone. Progesterone deficiency is the main reason that I find that women can't get pregnant. And if we did nothing else but just put you on all natural progesterone cream and cycle it through the middle part of your menstrual cycle, 80% of the women that I work with get pregnant. I mean, it's just that simple. So all these other things are just icing on the cake, so to say. It just really guarantees your success rate. So all these steps are just building on each other. But this step 3 should probably be step 1 because it is the most important. It's really important that you use natural progesterone. Synthetic progesterone is different than natural progesterone. And in fact, synthetic progesterone is found in birth control pills. So it can cause miscarriage. It can keep you from getting pregnant. And yet a lot of doctors still use synthetic progesterone, even in fertility treatments. And so I think that's part of the problem why they have so many failure rates with in vitro and the processes that they do. I've used all-natural progesterone cream with my patients menopausally, with PCOS, endometriosis to calm down the estrogen effect, and it's absolutely amazing. I've used compounding pharmacies for years for this, but I have found a dermal balancing system that's without prescription that is just as potent, and it's absolutely wonderful. The word progesterone comes from the Latin progestation, which means for pregnancy. So this is the most important hormone to get pregnant and stay pregnant. I was just talking with one of my nurse practitioners the other day, and she said, I love your program. I love what you do. I love hearing the women's success stories. She said, but I have a question for you. And I said, what's your question? And she said, why do women not ever tell anybody that they're pregnant until after the first trimester, after the first 12 weeks? Why do women feel compelled to keep it a secret? And I said, oh, that's easy. I said, because miscarriages happen in the first trimester, because that's when you're most likely to lose the baby. And you don't want to have to tell everybody you're pregnant and go back and tell everybody you're not pregnant. And in fact, I did that too. When I miscarried my little girl at 3 months, we had pretty much waited right up until that three month mark. And then we started telling everybody, and we had told everybody, we had posted it everywhere. And it was literally not a week later that I had my miscarriage. And that was the hardest part, was going back and telling everybody, no, it didn't work out. And then you had to hear all the, you know, oh, I'm so sorry. And then all the, it's God's will and all that stuff. That's just what you don't want to hear at that time. It was just, I really just wanted to, grieve and not have to talk to all those people, about my situation. So the reason that you miscarry in the first trimester is because there's not enough progesterone. So what we do is, once you get pregnant, you continue the all natural progesterone for the first 3 months. And it's absolutely safe for the baby and will promote the pregnancy. So it's very important that you do stay on that, and that's in our protocol. So, and that's very easy to follow. It's just a topical cream. We use topical creams because when you take hormones by mouth, they have to get absorbed through the liver. So when you use the skin, it goes directly into the bloodstream. So we love the natural progesterone creams. You have to understand ovulation to use this cream properly. And what we do is we use the cream either continuously or just cycled. And day 14, if you look at the menstrual cycle, I drew this little picture here, day 0 here all the way to day 28. Most women have an ovulation cycle of about 28 days. And so at about day 14 is when you ovulate. You're probably already tracking your ovulation. Maybe you're using ovulation trackers or a calendar. So you're probably familiar with this. And this is the day that you want to have intercourse. That's your most fertile day, when the egg is popped out and it's ready to be fertilized in the uterine lining. So what we do is days 11 through 21, what is happening is this estrogen is peaking, and then progesterone normally comes in here to trigger this luteal phase, basically. And if the baby gets fertilized, if the egg gets fertilized, then you want to have this progesterone effect to make this lining nurturing for the baby. What happens is, if you don't fertilize an egg, or if there's no sperm available, then this lining sloughs off and you have a period. Well, in women who have too much estrogen effect and not enough progesterone, they just keep building up a lining, building up a lining. That results in heavy bleeding, endometriosis, polycystic ovarian syndrome, all sorts of issues, fibroid tumors, and it can be absolutely miserable. Premenstrual tension syndrome, PMS, all those problems. So what we do is we use the natural progesterone right here in the middle of the cycle of days 11 through 21 to calm down this estrogen peak. And it also helps promote the pregnancy once the implantation occurs. So if you're not ovulating regularly, it will get you ovulating regularly within 2 cycles. So this is very exciting. And I've had great success rates with this. Women will also have lighter periods, 1 to 2, maybe 3 days of spotting, no PMS symptoms. If you have migraines, bloating, all that stuff that comes with your menstrual cycles, it will absolutely cure that. And that's one of the things with in vitro and all those other problems. You have headaches, migraines, menstrual cramps. I mean, it's all crazy, and it's miserable for those women. This is actually going to make you feel better in the process. And somehow I can't help but think that, emotionally, spiritually, psychologically, if this process is making you feel better and not worse, you're going to be so much better prepared for your baby and really being able to focus on what's coming and just feel good. So step 4, medical grade supplements. And what we use in our office is truly medical grade. You have to have a medical license to order these things. They are tested and true, and they don't have fillers in them. If you have like food sensitivities, if you have sensitivity to wheat or dairy or soy, so many vitamins or, supplements have fillers in them that have that stuff in them. So if you have food sensitivities, they're actually detrimental to you. Some of them have folic acid in them, and I'm going to talk about folic acid here in just a second, which can actually be detrimental to you, your health, and your baby's health. So medical grade supplements are absolutely essential. You cannot go to Walmart and get what you need. And I wish that, I hear doctors tell people all the time, you don't need supplements if you eat right. Well, first of all, who really eats right? Who gets 10 to 15 vegetables a day? And then even if you did eat 10 to 15 vegetables a day, there's toxins in our environment that our liver has to clear. And then there is, just minerally depleted. It just doesn't have all the stuff like magnesium and iron and all the things in it that we need. So I am I believe everyone's got their opinions, but it really resonates the truth with me that to some degree, you're going to have to take some supplements the rest of your life just to get the bare essentials. And so I love being able to use my nerdy little brain and formulate things to keep it simple. And that's what we do. And my husband has amazing experience with working with nutraceutical companies, and that's what he's done most of his adult career. And so we work together to formulate things that are the purest of the pure and really work for what we're trying to do. So I'm going to jump into this whole thing about folic acid. I know you're probably thinking, what's this lady talking about? Everyone knows you have to have folic acid. That's essential. And so I want to kind of tell you where that came from, just to give you a little historical perspective. And my stepdaughter has spina bifida, so really is real to me. You know, it's not just some kind of, oh yeah, I heard that happened. This has affected our family. What happened was the food supply has changed drastically over the last 40 years, and I don't think anybody disputes that. We don't eat as many vegetables as, our parents and our grandparents did. And so over time, what happened was we started to see birth defects, neural tube defects, spina bifida. And so what the scientists basically said to the government, because it's a huge financial burden, I understand that. My daughter has to have catheter changes every 2 hours. She has to have enemas, her wheelchair, her handicap accessible, all that's very expensive. So the government said, this is a huge financial burden. What are we going to do about this? And the scientists came back and said, well, it's a folate deficiency. Folate is found in green leafy vegetables. So they said, okay, well, we got to put folate fortified in the food supply. And the scientists came back and they said, oh, folate is really expensive to extract. You basically have to get it out of vegetables. And the government said, well, we can't do that. That's too expensive. What's our alternative? And they said, well, hey, what about folic acid? It's almost the same. Let's just put that in the food supply. Well, the problem is folic acid is not the same as folate. Chemically, structurally, it's kind of like synthetic progesterone versus natural progesterone causing birth defect or causing miscarriages or preventing pregnancy versus progestation and promoting a pregnancy. Well, it's just enough hydrogen oxygen molecules to be different enough that it doesn't work the same way in the body. And it is produced cheap because it comes from, sometimes they have bacterial cultures that just poop out folic acid. And it's absolutely not the same thing as folate. It's kind of like this little Smurf picture here. It looks kind of like the same picture, but it's really not. I have kind of a funny picture. I don't have it on here today, but it's the lady on the insurance commercial that picks up her son from school. And the child says, "You're not my mom." And she says, "Well, I'm in the age range of 30 to 40. I drive an SUV." She's like, "Close enough." And the little kid's like, "That's not close enough. You're not my mom." So, it might look the same, but it's not the same. And it can be absolutely detrimental. Folate actually helps clear unhealthy forms of estrogen if you have hormone imbalances through the liver, and it eliminates toxins. So it balances your hormones and it eliminates toxins, two very essential things for infertility. So I'm going to skip forward here. This methylation from folate helps repair cells. It prevents wrinkles. It prevents inflamed guts, leaky gut. It causes you to form new brain cells. It balances out stress. It clears toxins. It prevents neural tube defects. It prevents B12 deficiencies, which can cause weight gain and energy issues. And on and on and on. So heart disease. In fact, the first time that I ever encountered this issue with this whole methylation issue, I had a lady who had had 13 miscarriages. She'd had a baby born, and at 3 months, the baby had hypoplastic heart. Everyone in her family had died of heart disease in their 40s. It was just unbelievable, the methylation issues genetically that this family had. And so I thought it was pretty cool. I discovered, what was going on with her. I kind of patted myself on the back for finding that rare thing. Went on the internet. The CDC called it a rare genetic defect in people who can't metabolize folic acid, because it's clearly not the same thing as folate. And so anyway, as I kept checking people over the years, I kept finding that it was not rare at all. And in fact, just about anybody who is infertile has 1 or 2 copies of the genetic defect, and they absolutely cannot metabolize folic acid. And you need the folate for all of these processes. So if you can't convert folic acid to folate, you can't methylate, you can't clear toxins, and you can't balance your hormones. And now the CDC has actually changed their rating. They don't call it a rare genetic defect anymore. It's in about 70 to 80% of the Caucasian population. So if you're dealing with infertility, you absolutely have to know this. And when I talk about clearing toxins, this methylation process works like bagging the trash. So if you want to put your trash out at the curb for the trash man to identify it, you have to put these oxygen, hydrogen molecules, methylate these toxins, and it tells the trash man basically to take it out, tells the liver to clear these toxins. But if you leave your bicycle out there, the trash man probably knows that, hey, they just left their bicycle out there and they're not going to take it. So this methylation process is absolutely essential if you want to clear toxins out of your body, for your body to be able to identify. Otherwise, you're going to accumulate toxins. You're going to upregulate your cortisol, which is going to upregulate belly fat, which is going to pull all those toxins in to protect you. And it's just going to store them and keep them. And that's not where anybody wants to be. That's not healthy. And it's eventually those toxins are going to accumulate to the point they're going to spill over and start affecting your internal organs and start affecting your ovaries and your uterus. And, for fertility issues, that's huge, or for infertility. So these methylation problems are the #1 cause of miscarriage. And when I had my miscarriage, I asked my doctor. I didn't know anything about this. And they were like, well, we don't know why. And it's very common. 50% of all pregnancies end in miscarriage. Women don't even know they're pregnant half the time, when they miscarriage, and they just have another menstrual cycle. So this methylation issue is essential to understand in this fertility realm. Methylation problems happen in spina bifida. And, it's interesting because my husband's ex-wife, she felt so judged. So many times people would just look at her because, our daughter has spina bifida, and it'd be like, didn't you take your folic acid? And, it's just nasty, some of the responses that she got. And she did take her folic acid. And the problem is that what she didn't know was that her body couldn't process the folic acid, and she was actually hurting herself and her baby. So, it's huge with spina bifida, and the general population at large does not know about this situation. So when you start talking to people about folic acid, they'll be like, what are you talking about? They will not know. So I encourage you to do your research and understand this. Autism, this is huge with methylation. And what happens is if you can't clear your toxins, you can't methylate. If you take immunizations, because everybody's like, well, immunizations, they cause autism. Well, the immunizations don't cause the autism, but the toxins or the mercury and things in the immunizations, if you can't methylate it or clear it, it's going to accumulate in your brain. And so you are going to have problems with attention deficit disorder, autism, and these are huge. The general school population, I think the recent stats are about 60% of all kids in public schools have been diagnosed with some sort of attention deficit disorder. So methylation is huge in our society. Scoliosis is curvature of the spine. If you can't clear toxins, you can't form neural tube, you can't form connective tissues correctly. Autoimmune disorders, where the body starts attacking itself. Anxiety and depression. And 80% of your serotonin, which is your happy hormone, is formed in the gut. And if you can't methylate through the gut and the liver, you're more likely to have anxiety and depression. And I find that most anxiety and depression are low levels of folate. And there are many, many documented studies with low folate and anxiety and depression. But unfortunately, the traditional medical model just wants to put everybody on antidepressants. And that's a multi-billion-dollar industry too. So they have everything to gain by just putting you on Prozac or Wellbutrin or something like that when you have a methylation problem and you need folate. Weight gain, hormone imbalance, diabetes, blood pressure issues, heart disease, it just goes on and on. So it's very important. If you have family members that have any of these disease processes, you could absolutely change their life. And the cure for this is basically to give folate or methylfolate, not folic acid. It's completely different. It's a little harder to find to supplement with folate. Basically, eat your green leafy vegetables and you get folate. but it is hard enough to get enough folate to override all the folic acid that's been fortified in all the vitamins and the food. In fact, with my fertility patients, I usually ask them to start reading food labels, and anything with folic acid, try to avoid it. So one of the problems with folic acid is that it builds up something called homocysteine, and homocysteine is very inflammatory, and you can actually check homocysteine and folate levels in the blood. But this can predispose mom to having miscarriages, because if you have little blood clots to the uterine arteries or the umbilical arteries or veins, basically you can't get pregnant. And then when you do get pregnant, if you have a little blood clot in there and you lose blood flow, that could cause birth defects, it could cause cerebral palsy, it could cause lack of oxygen because you need that blood flow to carry the oxygen, and it can cause miscarriages, which can be absolutely devastating, especially late pregnancy miscarriages. Seem to be more emotionally taxing than anything. And when I had my miscarriage, I didn't get out of bed for 3 days. It was so emotionally taxing. It was horribly painful. I literally had to go through the contractions of childbirth for almost 48 hours. And there was no baby at the end that, I could snuggle and cuddle and put pink booties on. And it was just, that's devastating. I don't want anyone to have to go through that. So step 5 is get 8 to 10 hours of sleep a night. And I know this is hard with as busy as we all are and things that we have going on in our life, but this is absolutely so important. And the interesting thing about natural progesterone or having healthy progesterone levels is progesterone is essential for sleep. One of the challenges that I've had with postmenopausal women is that doctors don't want to put them on progesterone. They just put them on estrogen. And without progesterone, you gain weight and you don't sleep. And it's just, there's a whole lot of history behind that. I do a whole talk on estrogen and progesterone postmenopausally, and that's not really relevant here. But progesterone is essential for sleep. In fact, my mom is in her 70s, and she's on progesterone cream, and she uses it at night. She just calls it her sleep cream. She has no idea what it is. So if your progesterone is low, which it absolutely is if you're having fertility issues and you're listening to this webinar, your progesterone has to be low. I mean, it's just kind of a no-brainer for me. And so sleep is really hard. So if you've struggled with sleep, the natural progesterone cream is absolutely amazing and will get that good quality sleep that you need. You have to go through multiple sleep stages multiple times through the night, and they have to go in a particular order. If they get disrupted at all, then that can really interfere with things. So very important to get that good sleep. Step 6, focus on stress reduction and keep positive and motivated. And I know that this is hard. As 13 years went on, 13 years is a long time to struggle with fertility or infertility. And I know that starts to wear on you. So I hope that this webinar today is the first inkling of hope that you have and that you'll start focusing on the positive. In fact, we've got some support information, videos, and what I want you to do is really start focusing on that baby. Go ahead and buy those little unisex onesies and start really preparing mentally for the baby. When my mom had bought my baby that I lost a bunch of little pink clothes, and I remember after I lost her, it was just so devastating. And, I know it's scary to get your hopes up, but it's so exciting to know that there are things that you don't know and things that you can do about it. And I wish I had known all of these things about hormone balance and folate and, how to control stress and all those things back then. It would have been so different for me. But everything happens for a reason. God does things for us, not to us. And I wouldn't be able to help you in the way that I can now if those things hadn't happened. So really focusing on stress reduction and keeping positive is so important. And one of the things we do in our coaching program is self-hypnotism and using stress reduction techniques. We have a great program that one of our dear friends and colleagues has devised that you can use for stress reduction. Just amazing things. So I'm excited to share all that information with you as well and different techniques. Yoga is wonderful. If you can get into a yoga program, yoga nidra for stress reduction, those are all wonderful. And really just keeping a positive attitude and clinging to that hope that we're giving you today. Step 7, get ready to get pregnant and have a healthy and happy pregnancy, a healthy baby, and feel good for years to come. So these principles that you're going to learn through our coaching I want you to really focus on getting healthy and staying healthy forever and sharing this information with your spouse, with your family, with your children to come, because that's where I get really excited. And that's what we do in our wellness program and our hormone program every day, our infertility program. It's really changed the lives of people and helped them feel better. And that's so exciting when people come back and say, you know what, I thought I just wanted to get pregnant. I didn't realize I didn't feel good. I didn't realize I felt as bad as I felt. And I'm so excited to feel as good as I feel. So it's a game changer. Supply and demand is driving a different type of patient, a different type of person in this country. And I'm so excited for that. People are empowering themselves and they want this information. The first and best thing that you can do is just empower yourself. In fact, I wrote a book in medical school called Tools for Taking Charge of Your Health Care, and it was all about patient empowerment. So I've been about this for many, many years. And it's just so exciting for me to be able to help people empower themselves, take charge of their health, and know exactly what's going on. I would have killed for this information, for this folate information, for this the food sensitivity information. Would have helped my hormones. I had terrible menstrual cycles. I was miserable, headaches, nausea, vomiting. I was, just being a woman in my skin was completely miserable. So all of these things have completely changed my life, and I'm so passionate about changing other people's lives as well. So you're at a crossroads today, and you can keep doing what you've been doing, and that might, work for you, or that might work for some. But I'm really excited to work with you. We can only work with so many people because we have a very intensive coaching program. These things are so different that we teach and share the way you change your life, the way you change what you've thought about food, literally diesel fuel and unleaded fuel. We have to identify that and get you on the right track. So if you want to get started doing something different, you can come in and see me in our clinic, or you can do this completely at home. If you're doing the home program, our coaches are only taking 10 applications per fertility cycle, and we call a cycle 3 months. So if you're listening to this webinar today, we have a lot of folks on here, so we want you to go ahead and get signed up as soon as possible so that you can be one of the 10 if you want to do the home coaching program. The process is a little bit different if you want to come into the office. We have 5 clinics now. Our main office is in Rogers, Arkansas, but everything that we do can be done at home. In the comfort of your own home. Even the testing, we do finger stick and saliva testing, so it's all very easy to do, and our coaches will walk you through the whole process. So you'll definitely want to get involved if you want to be in this next cycle. So coming in, doing something different, what you're going to do is go to www.naturalfertilityapp.com and fill out an application. And what we'll do is one of our coaches will call you and see if you're a good fit. We have 100% success rate, and so we don't want to work with people who aren't what we call A or B students, and those are the people who are really willing to take the coaching to the next level and change their lives, change their health, and get pregnant. So if you're just kind of, I'm going to think about it, this isn't for you. So we only really want serious people. So go to naturalfertilityapp.com, and what this complete fertility evaluation is going to be is a 1-hour phone consultation. Fertility evaluation. So we're going to ask you some very specific questions about you and your significant other, and just weed out if there are any potential severe medical problems that could be keeping you from being successful in our program, and then develop a plan of action for you. And that's different for everybody depending on what your unique needs are. And so that's the exciting thing, is working with individual coaches. So you might be wondering, well, I'm not really sure if this is right for me. So our program is not right for you if you just are stuck in the box thinking, oh, that's all just crazy. I know that I've really struggled with fertility. I know there's something wrong with me. I know I'm going to have to do something serious like heavy drugs and infertility treatments like in vitro. So if you want to spend $20,000 or more to have a baby and you want to go through all that process, then we're not for you, because we are a drop in the bucket compared to that. We want to make it affordable for everybody. We want to get, our goal this year is to have 1,000 women pregnant this year in 2015 that we can, that we're tracking. So we want 1,000 pictures on our website. this is not for you if you feel like in vitro is the only way. So if you're kind of stuck in that mentality and you're just kind of exploring and, looking for some information today, then us working with you and coaching you in this natural method is probably not for you. If you feel like dangerous drugs are the only way for you, or dangerous hormones, then absolutely not for you. Or if you're unwilling to have hope, hope is kind of funny. I saw this article the other day that a lady had written in. It was a letter she wrote to her fertility doctor, and basically she was saying that she walked in there with a smile all the time, but she was still skeptical. And after she spent $15,000 on her credit card, she was still skeptical. So it's a challenge and a struggle, even if you do go that path. But with us, we want you to really focus on a positive attitude and having hope. And that's who we work with, is those people who just want to get healthy and have a healthy, happy baby, happy pregnancy. We can't control everything. My disclaimer is that we don't, we can't control all the variables. And do miscarriages happen? Yes, they do. Do pregnancy losses happen? Do birth defects happen? There's a lot of things that have accumulated in your body over the years. And regardless of whether you did in vitro or whether you did our natural program, things can still happen. I don't know what the overall ultimate design for your life is. And I always say things happen for you and not to you. So I don't know, what's coming for you. But I do know that our program works. I know that it's worked for me, and it's worked for thousands of women. So I'm very excited. And, like I say, the main thing is I just want you to have a natural hope and to really be excited about what you're doing with us. So again, this is our office in Rogers, Arkansas. You can come in. We also have offices in Little Rock and Dallas and Oklahoma. Or you can do the whole system at home, which is nice for a lot of women because coming in and getting poked and prodded. You saw Ashley in the video, getting the shots and, having rectal exams and pelvic exams and all that is just, miserable. And nobody wants all that. You just feel so clinical. I was talking to somebody the other day at a birth center that gets you away from the hospital to have your baby, basically, which is wonderful. You have midwives and they have birthing tanks. And it's like we have medicalized having a baby to the point that it's just such a medical experience now, and it is the most natural experience. Getting pregnant, having a baby naturally, that's the ultimate God's design, and yet we make it so medical and we make it so uncomfortable and painful, and it just simply doesn't have to be. So again, on this cycle, and I'm already looking, we've already had, I think, 3 applications in, so we've only got a few left. So you'll want to go to naturalfertilityapp.com right away and get signed up, and we can do the whole home program with you. So what I'd like to do is, if anybody has any questions, there is a little area where you can type in your questions, and I'll be happy to take them. So somebody just asked, can I do this from home? I live in Arizona. Absolutely. And that's kind of just what I was saying. Our coaches can work with you at home. No problem. Somebody just asked, I have terrible migraines. Will this help my migraines? Absolutely. Like I said, the natural progesterone cream helps balance out the hormones. So that's a absolute wonderful way just to get healthy and feel better. So I know we're a little limited on time. So if you want to email me, if you go to the website, there's a place where you can email questions, and I'd love to field those. Y'all have been a wonderful audience today. I am very excited about your future. I have so much hope for you, and I hope that I've given you hope today. Again, please just go to naturalfertilityapp.com, fill out an application, and one of our coaches will get back with you within 24 hours to talk about the process. If you don't make it this cycle, I have lots of information online, educational information. Go ahead and start all the things I've talked today. I usually tell people go gluten-free and dairy-free. Those are usually the most common food sensitivities. Start some exercising, get your folate, not folic acid, and then let's get you in the next cycle. So just start getting healthy, and those are some things you can start doing right away. So you all are precious to me. Your babies are precious to me. Your future is precious. Thank you again so much for being here today, and I look forward to talking with you very soon. Have a blessed day.